This 30-minute webinar features Dr. Emil Tangeti of Sacramento, California, who is a graduate of the University of California, Davis and the UCLA School of Medicine. After finishing residencies in internal medicine at Stanford University and dermatology at Harvard School of Medicine, he completed a photomedicine fellowship at the Wellman Labs at Massachusetts General Hospital. Dr. Tangeti is a board-certified dermatologist and a fellow in the American Academy of Dermatology and the American Society for Laser Medicine and Surgery. He is also a fellow of the American Society for Laser Medicine and Surgery and a member of the California Medical Association, the American Medical Association, and the American Academy of Dermatology. Dr. Tangeti will share the latest clinical and histological review about PicoSure Focus and the benefits it has brought to his patients and practice. He will also share collective best practices and experiences from his colleagues. In addition, Sarah Bryce, a registered nurse, will conduct a brief PicoSure Focus treatment to demonstrate how fast and easy it is to perform. Finally, Dr. Tangeti will respond to commonly asked questions to inform how to expand your PicoSure offering with Focus.
I believe that a significant contribution to the clinical effects that we are seeing is coming from the induction of a laser-induced area of optical breakdown in the epidermis. This unique injury results in new collagen, elastin, and mucin. As a result, the PicoSure Focus has enabled me to deliver effective skin revitalization treatments with virtually no downtime for my patients.
Well, what I liked about the PicoSure is that I had no downtime afterwards, so I didn't have to worry about going out an hour later and having a lot of redness. It was really easy to leave the building and go on with my regular life. And I also got the benefit of a firmness, which I liked. And then, of course, I got the benefits of the pigmentation being lessened as well. I would recommend PicoSure to other people. I believe that they would find that the benefit of the positive pigment change and the firmness, and then the bonus of not having it take a long time to have done, the quickness of the procedure and the ease of the procedure. And it's relatively painless. So that's a bonus too.
Hello, I'm Emil Tangeti, a board-certified dermatologist. I practice in Sacramento, California. I've been in practice for over 30 years, with 20 years devoted to light and laser devices. We offer a range of services from tattoo removal to skin revitalization. We see a variety of patients, each with distinct interests and personal needs. I've invested in the PicoSure platform because I knew it would provide clinical benefits to my patients. PicoSure's ultra-short pulse durations create an intense photomechanical impact known as pressure wave. Pressure wave shatters the target ink and pigment, and this process results in better clearances with fewer treatments, all with low fluence and minimal injury to the surrounding skin. As many PicoSure customers have experienced, including myself, tattoo removal success with fewer treatments has had a significantly positive impact on my practice. PicoSure technology has dramatically reduced the number of tattoo treatments required versus Q-switch lasers, and my patients have begun asking for PicoSure treatments for proven, faster results. In addition to being the world's first picosecond laser, PicoSure is the only system with the breadth of applications, including the proprietary Focus lens array, which enables skin revitalization treatments. PicoSure Focus has opened up an entirely new and exciting treatment opportunity for my patient population. I believe that PicoSure Focus treatments will continue to expand and demonstrate their value as more PicoSure customers learn about the benefits for their patients and their practices. I am particularly interested in the histological aspects to better understand the unique mechanisms of action that PicoSure Focus is creating in the skin. With its Alexandrite 755 wavelength design, PicoSure energy has the distinct advantage of being highly absorbed by melanin. This allows PicoSure energy to be efficiently delivered to the patient with minimal side effects. The Focus lens is able to amplify this advantage in a way that has never been seen before. It has led to some new histological and clinical findings that I will share with you. So let's get started.
Hi, I'm Sarah Bryce. I'm a registered nurse, and today I'm going to be introducing you to the PicoSure Focus for Skin Revitalization. In my recent travels around the country, I've realized that most people with the PicoSure are primarily using this for tattoo removal. But what we want you to understand is that this PicoSure Focus treatment has an added benefit that can help your patients as well as your practice, and it's so easy to use. This is a treatment that can be used for pigment, wrinkles, acne scarring, and overall skin revitalization, which is going to be so easy to use and take you less than 15 minutes to do. Your patients will be so happy and thrilled with it because there's going to be no downtime. So let's go ahead and get started. We're going to put the hand pieces together and do a treatment, and I'll show you how quick and easy this is to do. So we're going to go ahead and get started and put the focus tip onto the lens. And for those of you that have been doing primarily tattoo removal, you probably have had the zoom handpiece attached to the arm. And at that point, you're going to take off the zoom handpiece, and we will be replacing it with either the 6, 8, or 10 millimeter handpiece for the focus treatment. For this treatment today, we're going to be treating a skin type 4, and we're going to be using the 6 millimeter handpiece. This is the handpiece that you're going to be using most of the time for this treatment. The focus tip will just attach to the end, and then you'll put your distance guide right on the tip. To insert the handpiece, you're just going to align the 2 red dots and give it a click to the right and lock it in, and we're ready to go. Your PicoSure is going to come with a case containing 3 fixed handpieces. There will be a 6 millimeter, an 8 millimeter, and a 10 millimeter. You're going to be using the 6 millimeter most of the time. However, for your darker skin types, you could consider using the 8 millimeter as well. So now it's time to bring in our patient and begin the treatment. Before beginning any treatment, you're going to want to review the PicoSure Clinical Guide for a complete list of all the indications and contraindications for PicoSure treatments. As with any medical procedure, it's important to review the patient's age, skin type, medical history, family history, current medications, the reason that they may be seeking treatment, and understanding their expectations. Patient documentation is important to the success of any laser treatment. Sample forms as well as pre- and post guidelines are provided in your clinical reference guide. It's important to take a picture before beginning the treatment so that you can document the improvement with each treatment. We want to make sure that we clean the face with alcohol and/or soap and water to make sure that we remove all the makeup, lotions, and oils. Before beginning the treatment, it's also important that all personnel in the room and the patients are wearing the appropriate protective eyewear.
All PicoSure systems ship with the focus lens array capability, and 3 focus treatment tips are included. Focus is usually used with a 6 millimeter handpiece, but the 8 and 10 are also available. The focus lens array is composed of a closely packed hexagonal array of diffractive lenses to focus and redistribute each pulse. It serves to concentrate energy into hundreds of microspots. Fluence within each microspot is magnified up to 20 times that of a standard pulse, and it's delivered in a fractional manner. 70% of total energy is delivered through the microspots, and the remaining 30% results in low fluence background. By design, less than 10% of the tissue is exposed to ultra-high fluence. This injury generates new collagen and elastin with minimal downtime and discomfort. In contrast, thermal-based lasers create a column of injury in the skin, resulting in more downtime and pain. PicoSure Focus creates an incredible phenomena under the skin, which I will now describe. This graphic will help me explain how PicoSure Focus uniquely creates an area of laser-induced optical breakdown in the skin, commonly referred to as an LIOB. A high-intensity portion of the PicoSure 755 laser beam created by the focus lens array irradiates a region in the epidermis. A lucky electron from melanin is ejected from an absorber. The number of free electrons grow in an avalanche process. The target increasingly absorbs energy from the beam and shields the underlying region. Finally, the laser pulse terminates, leaving a vacuole in the epidermis containing cellular debris, but is not connected to the overlying skin structure above it or below it. The question is, what is happening in the skin? We have views here at 10 minutes and 24 hours after treatment. This question has intrigued me and has inspired much of my histological clinical research. Immediately after, approximately 10 minutes after focus treatments, the first two images demonstrate the vacuoles, voids, which we refer to as LIOBs in the epidermis. 24 hours after focus treatments, the melanin staining in the second two images show clumped melanin in these injury zones. No thermal injury is noted to the dermis or in fact the surrounding epidermal cells. The third set of images at 24 hours after a focus treatments show dermal inflammation and a healing response which we believe leads to new collagen, mucin, and elastic tissue. This very nice series of photos demonstrates a typical patient with a PicoSure focus treatment. We can see here immediately after and up to 3 hours you see some residual erythema. This can be easily hidden with makeup. At 24 hours, no residual erythema remains. PicoSure focus users, as well as those considering adding focus treatments to their practice, are often asked to compare the complete patient treatment experiences and results among different non-ablative and ablative laser treatments. This can inform how to position the focus treatments for your patients, knowing many will generally prefer revitalized skin results with minimal downtime and discomfort. I would like to compare PicoSure Focus histologically to other fractional treatments to distinguish them based upon the type of injury they create and the downtime associated with the patient's treatment experience. With most non-ablative treatments, you can see columns of thermal injury that with more aggressive settings, you can see them penetrate deeper into the dermis. Both of these leave an epidermal injury that's open to the air. With focus, there are no open lesions and no thermal injury, just an LIOB with the benefits that appear to lead to collagen and elastic production as well as mucin. It is interesting to think that we can have an isolated epidermal injury lead to dermal repair and remodeling. The question is, what happens to the skin after a PicoSure focus treatment? If we look here at these three slides, we can see the initial injury, the LIOB, and then over a period of days to 2 weeks, we can see that this forms a menzone that migrates up the epidermis and is exfoliated at the end of 2 to 3 weeks. This slide graphically shows the high-intensity region influences with the different handpieces. The 6mm, my typical handpiece that I use for most patients, shows a very high energy focus at the surface. As we go to the 8, we cut this to 56% of the original handpiece energy and to the 10 to 36%. Typically, for my darker skin types, I'm using the 8 and then we'll later go down to the 6. But again, you have choices with different energy configurations to best suit your patients. While I have studied and continue to study the focus histology closely, Dr. David McDaniel has also used PicoSure Focus frequently in both clinical studies as well as his practice. This histological slide shows collagen on one of his patients 6 months after 4 focus treatments. Note the increased collagen deposition, the blue stain. This correlates with fine line and wrinkle reduction. Also very interesting is the increased elastin density 6 months after 4 focus treatments. Note the increased density of elastin fibers, the gray stain. This is what leads to the visible improvement seen in our patients. In clinical practice, patients are often seeing visible improvements after their first PicoSure focus treatments, but they also see continued skin revitalization even many months after their 3rd and 4th treatment. This is likely a result of new collagen and elastic tissue deposited over many months. These exciting results have also been reported by another group, Dr. Roy Geronimus and his colleagues at NYU. They documented increased collagen, mucin, and elastic tissue 3 months after a series of PicoSure Focus treatments. Summing up, PicoSure Focus has unique advantages. Before I share some representative before and after photos from my practice, as well as other PicoSure users. I want to summarize some of the unique advantages of PicoSure Focus. An LIOB, a very elegant, unique injury in the epidermis that results in increased collagen and elastic tissue fibers. Visible clinical benefits without traditional downtime seen with most ablative and non-ablative procedures. Comfortable, easy and quick treatments, high patient satisfaction. This is a practice differentiating procedure which can be performed all year round, summer as well as winter. This is a nice photo from Dr. David McDaniel showing photo damage treatment. We see improvement of fine wrinkles, coarse wrinkles, and mottle hyperpigmentation. Next are some photos by Dr. Weiss. This shows before and afters, fine wrinkle treatment associated with photo damage. We can see here, after 4 focus treatments, improvement in these, especially on the lateral canthal area. The next set of photos is a patient of mine who is a skin type 4, MI of 27, who had a series of 4 focus treatments. You can see improvement of the acne scars, dyspigmentation, as well as the overall lightening of her skin. The next group of photos are a patient of mine who has photo damage with mottle hyperpigmentation after a series of PicoSure focus treatments. You can see an overall lightening of the skin and an improvement in the skin tone. The next set of photos is from Dr. Shin in Korea. These show patients with dyspigmentation, lentiginous, and mottle hyperpigmentation. We see improvement after a series of PicoSure focus treatments. The next set of photos are from Dr. Roy Geronimus' group in New York. They show improvement of a patient with acne scars and also dyspigmentation after a series of 4 PicoSure focus treatments. We can see nice improvement of the quality and tone of the skin. This is a set of before and after focus treatments from Dr. Roy Geronimus. This is for acne scars. We can see improvement of the depressed areas on her cheeks, as well as the overall tone of her skin. These photos are from Dr. Saluja, a patient with acne scar and dyspigmentation after a series of focus treatments. We can see very nice improvement of the changes associated with this scarring condition of his face. This is a patient from Dr. Saluja's practice with dyspigmentation and photo damage that shows improvement over a series of 5 focus treatments. We can see the pigmentation as well as the fine wrinkling improve. The next photos from Dr. Saluja show a patient with lentiginous and mottle hyperpigmentation with improvement after 1 focus treatment session.
So I prefer to draw out the quadrants of the face to help give me a guide on the areas that I'm going to be treating. Typically on a face, we're going to be putting in somewhere between 5,000 and 7,000 pulses, and we're going to focus more of our pulses into the troubled areas. What I'm going to be doing is focusing more of my pulses into the areas of concern, which are going to be the areas of the cheek with the acne scarring, as well as the chin with the scarring, and this other cheek. Her forehead looks pretty nice, so I will go over it, but I won't be putting as many pulses into that area. So we're working with our 6mm handpiece, and we're going to be working today with 10 Hertz. And that's going to leave us automatically set at 0.71 joules per centimeter squared. In the top right-hand corner of the screen, you can see the amount of pulses that are remaining on the focus tip that we have. Our pulse counter on the left-hand side of the screen should always be set at 0 so that you can count how many pulses you're doing into each quadrant. And now I'm going to hit the standby button so that we're ready to go. And I'm going to have you turn your face to the left. There you go. And here we go. 1, 2, 3. When doing this treatment, it is extremely important that you have your angle perfectly perpendicular to the area that you're treating, with your distance guide touching the skin at all times. Our areas of concern today are the acne scarring, so we're going to be putting more pulses into those areas. the snapping that we're hearing is exactly what we want to hear. If your angle is slightly off, or if your distance gauge is slightly off of the skin, that will make that snapping sound that you hear now diminish. We're almost done with this quadrant here. And you can see her skin is getting kind of moderately red, which is only going to last for about 30 to 45 minutes after the treatment is done. So we put in almost 1,800 pulses into this cheek, which is actually perfect for her. And now I'm going to move into my second quadrant, which is going to be this second cheek. And let's see, turn a little bit more to the right for me. Perfect. We're going to start with our spot right here on the count of 3. 1, 2, 3. You're going to be doing probably somewhere around 4 to 6 passes over the entire area when you're treating, but you really would rather pay attention to the number of pulses that you're putting in instead of the number of passes that you're doing. Today we are treating acne scarring. However, she also has some pigment and just overall skin revitalization concerns that we will be addressing, so we are going to be treating the full face. So what we're looking for is we're going to see sort of a slightly grayish frosting. And we'll obviously see the sparking. And this is only going to last maybe 30 minutes to a couple of hours after the treatment is done. She is young and she does not have many wrinkles. So for her, her primary area of concern is the acne scarring. However, if there was any wrinkles here, we would be working on those as well. So now I'm going to move into my third quadrant, which is going to be my third area of concern. The chin area here, which has a lot of acne scarring, some pigment, and then we'll finish with the rest of the face. And if you'll notice, I am also using my left hand to sort of guide the arm, which will take some of the weight off of my wrist. And it just makes the treatment a little bit more comfortable for the user. Perfect. So now we're going to end the treatment with the forehead. We've concentrated most of our pulses into our areas of concern, which were the cheeks, chin, and now we're going to finish off with the forehead. In order to protect the hair and the eyebrows, I'm going to use a tongue depressor to cover those up so that we don't accidentally hit them. On the count of 3, 1, 2, 3. So as you can see, this is a very fast treatment. It's not going to take a lot of time. People come in during their lunch breaks or right after work, get this treatment done. They can put makeup on and go right back to whatever their schedule was needing them to do, and they're going to be ecstatic about that. We are complete with the treatment. And for this treatment today, we put in 6,227 pulses, which is perfectly just what we're looking for with her skin tone and the areas of concern that we're seeing here. And so we're all done. You can see here she's going to be mild to moderately pink for about the next maybe hour to 2 hours. Some people have more sensitive skin, which obviously that will be dependent on how pink they're going to be after. And she could put makeup on right away. She could go right back to any of her regular activities. And as far as follow-up and aftercare, she's going to just resume her normal skincare regimen when she gets home at night. Her typical face wash, moisturizer, that type of thing, and then she'll be good to go.
Question is, what is the correct number of treatments? Generally, we do 3 to 5 treatments, 2 to 4 weeks apart. and evaluate our patients at the end. What about the patient? Patients generally want a procedure with low downtime, something they can go back to work almost immediately. Again, the PicoSure Focus treatment permits this. It's a low downtime, low pain procedure that can be performed all year round. We treated many darker skin types with good success for acne scars and revitalization. What are the correct number of pulses? Initially we were starting at 3,000 to 5,000. Now we've moved up to 5,000 to 7,000. It appears that this gives the ideal revitalization response. A common point in patient consultation is, which device do I use? We have a fractional CO2, we have a 1540 non-ablative, we have the PicoSure. Again, this all depends upon patient, skin type, downtime. Certainly the more ablative procedures, more downtime, more risk. Non-ablative, more pain, more downtime. PicoSure, less downtime, perhaps a few more treatments, but again, at the end of the day, we have to match the best treatment with the best results for our patients. Again, PicoSure Focus positions very nicely because of downtime and the ease of treatment. The question is, why did I choose PicoSure? First of all, PicoSure is a unique device, but it boils down to a more fundamental question: why Cynosure? I've had Cynosure products since the early 90s. I found the company there, reliable, they always produce quality products, and they stand behind their products. If they make a product, they're going to service it, and I've had good results over many, many years with this company. A question often comes up for revitalization: PicoSure Focus versus Q-Switch Nd:YAG. Well, it's a pretty easy answer for me, and that is, I think about safety. We look at the PicoSure Focus unique injury with the laser-induced area of optical breakdown. It's unique to the epidermis. So I think it comes down to safety, comfort, and efficacy.
Thank you for viewing this PicoSure Focus webcast. For additional information and support, submit any clinical questions to clinical@cynosure.com. Submit any product questions to Bill Mitchell, Senior PicoSure Product Manager, at bmitchell@cynosure.com, or call 978-367-8752, or visit cynosure.com.